Welcome to Gut Fit Club. Gut Fit Club is online initiative by Kaizen Gastro Care. It's about well-beingness of your gut. It's about well-beingness of your liver, your colon, rectum, anus, and it's about whole digestive system. I am Dr. Samrat, a board-certified colorectal advanced laparoscopic GI surgeon based at Pune, India. Today we are going to talk on complex fistula in ano. Complex fistula is most complex disease of anal region. Offset, I request all of you, please subscribe our channel Gut Fit Club. You will get notification about our upcoming video, and also like the video what we are having. And if you have any query related your gut, you can post your comment. We are there to help you and give you answer. These all things going to help us to grow this channel, this community. I am most happy you are again today with me to understand about complex fistula. Complex fistula and simple fistula. These are two different variety of fistula. Why we need to divide? There are n number of classification. One of the best classification, the Parkes classification, we surgeon refers, that has lot of complexity. It's difficult to understand. After seeing all lot of thing, one thing that decided, the most important factor which decide in anal fistula is incontinence and recurrence. Wherever the patient is having fistula and we want surgery to be done, we need to grade that patient who is having high risk of recurrence, who is having high risk of incontinence. Those has to segregate it, and rest we can do a simple fistula surgery. That's old traditional fistulotomy that has the best success rate. So that segregation has been done by ACRS, and they divided simple and complex based on complexity in terms of outcome and risk of incontinence. Simple are fistula which are simple to treat and have good outcome, least chance of incontinence. Complex fistula, there are few parameters which has been defined the fistula is complex. One most important parameter is the fistula tract, which start from anal region, goes to outside skin. It goes through the external sphincter and it crosses the relation of the tract to the sphincter. It crosses the external sphincter 30%, more than 30% above, means it is the deeper level, it crossing the external sphincter. That fistula, when being treated by surgeon, chances of recurrence and chances of incontinence are high. Most important, another parameter is a female who is coming fistula which is there lying anteriorly, means upper part. If you take anal canal as a clock which is lying in between 11 o'clock to 1 o'clock. Why this is complex? Because that area external sphincter is thin in female. Chances of incontinence is higher if we divide traditional by surgery, traditional surgery such as fistulotomy. Those patients who had prior multiple surgery done, the sphincter is already weak, going to get done another one surgery, chances of doing the fistulotomy, traditional surgery which has the best result, the chances of incontinence going to be higher. If you are having prior incontinence, you have underwent many of the procedure prior for the fistula, for the hemorrhoid, and you are already having incontinence for the flatus, incontinence for the liquid, and whenever you have urge, then you are getting incontinence, you are not able to control, it is leaking. Those patients are high risk for a traditional fistula surgery if we are having fistula. If you are known case of IBD, particularly Crohn's, if we go for the traditional surgery, chances of incontinence is higher. Or you had something disease in the pelvis such as some uterine cancer, some anal cancer, rectal cancer, you had already radiated, so perianal muscles are weak, perianum is weak. In that scenario, you get traditional long fistulotomy surgery, chances of incontinence are higher. These are the few parameters, that is more than 30% of external sphincter involvement, anterior fistula in female, recurrent fistula, prior existing incontinence, radiation or IBD. These are the parameter. If you are having complex fistula. If we have multiple tract, multiple opening, tract are deep, you are having complex fistula. Only in complex fistula you need something called sphincter preserving surgery, because if we go for sphincter cutting surgery, possibility that the outcome are worse. Maybe you get rid of your fistula, but you are laying with whole your life with incontinence. Incontinence is you are not able to control your toilet, your shit is passing in your pants or innerwear, it is making dirt, or you have that urge of defecation and you can't control, you need to rush to the toilet. So those things will happen in this patient if we go for traditional surgery. Friends, it's very clear, the best surgery for fistula is traditional fistulotomy. But if you have complex fistula, you need to think for sphincter preserving surgery. Sphincter preserving surgery, n number of are there, starting from the lift, waft, fistula plug, stem cell therapy, nowadays laser, new added another one gadget into the fistula surgical device, laser surgery. So you need to discuss with your surgeon, am I having a simple fistula or complex fistula? It's not about the length of the fistula which decide you are having complex fistula. It's about depth of the fistula tract. How much deeper the fistula tract, that much complexity is higher, that much chances of your incontinence. It's not about internal opening is too high. It's not like that. It's about what the tract crosses the external sphincter. If it is crossing external sphincter, how deep it is, that much if we assess, then you will have the definition of complex fistula. Meet your surgeon. If you are having perianal problem, it might be abscess, recurrent abscess, you might be having recurrent fistula, you might be having something which is discharging outside, that's the fistula. If it is there, meet with your surgeon, discuss with your surgeon openly, ask him what is exactly, is it simple or complex? If it is complex, what parameter making me complex? If we are having complex fistula, discuss about what are the sphincter preserving surgery. If you are having simple fistula, why you want sphincter preserving surgery? Division of lowermost part of your sphincter doesn't going to land in incontinence. If you are having simple fistula, that is a one time, get done surgery properly by proper surgeon and remove complete fistula. Do the fistulotomy which gives 100%. Don't at all hesitate. Don't ask, I want laser. No, wrong. If you are doing laser for simple fistula, you are going to screw up by multiple procedure in the future. Don't tell about I want small wound. It's not your face where the surgeon is doing, it's your butt where you want complete cure, you want complete out of the suffering. Discuss about the problem, that is incontinence. What is risk of incontinence? Discuss about that is recurrence. What is risk of recurrence? Discuss about surgical procedure, whether you are going to do sphincter preserving, sphincter cutting. Sphincter cutting surgery is very easy. Fistulotomy or fistulectomy. Sphincter preserving surgery, n number of procedures are there. You need to discuss about the sphincter preserving surgery. If at all surgery is done, how is about the post of care? How is your surgeon expert about fistula treatment? What is his experience? Take second opinion. If you feel that you have not satisfied, take second opinion, then decide, because fistula surgery, first surgeon is best surgeon to treat. If he does well, you are get out of this problem in short period of time. Initial 5 to 10 days of some pain, some wound discharge is acceptable, but you will get rid of the problem. But if you choose wrong place, you are insisting about laser, you are insisting about pain-free treatment, you are insisting about like surgery getting done, I don't want scar on my face, you are landing in big trap. That will going to cause you suffer whole life, either with recurrence of the fistula or with incontinence that is very difficult to manage later on, which will not going to come back again. So just see, is it your fistula? Is it fistula? If fistula, definitely surgery is needed. Is it simple or complex? If it is simple, get rid of it by doing fistulotomy surgery. If it is complex, then find out the good surgeon, discuss all the thing, get genuinely proper care and get rid of the problem from the root. Give some time for your surgeon so that he can do the surgery, and have patience. Don't at all think about pain-free surgery. Don't at all think about a woundless surgery. Don't at all think about the quick outcome. These are all not exist in fistula surgery. Fistula surgery will have some pain. We'll have outside wound bigger, because inside, how much is a big cavity, outside that much big wound need to be done on the butt. But in 3 weeks it will go off. Initial few days pain will be there. Tolerate all the thing. Have patience. Have discussion with your surgeon and get rid of the problem. Thank you.